VEO-IBD, which is short for very early onset inflammatory bowel disease, is a group actually of diseases of the intestine in children. What we usually see with the diseases in children who have VEO-IBD is abdominal pain or distress, sometimes recurrent infections, sometimes bleeding of the intestines.
Everybody's really reluctant to really label that child with very early onset IBD, right? Because not only is it a difficult diagnosis to make, but there's no cure. And it's a lifelong problem, and it affects the child and the family and the community and all of the medical providers.
They don't often respond the way the older kids do to the medications, and often for not as long do they respond to those medications. So frequent dose escalations and med changes are required to keep those kids under control in terms of their disease process.
When my son Gavin started experiencing symptoms around 9 months, I fought long and hard for his diagnosis until he was 22 months and finally diagnosed. From there, like many people in this journey, we had many hospital visits.
My son was diagnosed with very early onset IBD, indeterminate colitis at 24 months old. In the span of 9 months, he started medication. He went through multiple biologics and high-dose steroids to where he couldn't eat and was in need of surgery. They removed his entire colon, and he now is living with an ileostomy.
Everett, he has always had issues, many respiratory infections, ear infections, and then once he was just under 2, he had his first blood transfusion, and that was kind of what sparked the doctor's interest in that something really is wrong here.
Vienna was diagnosed at age 7 with VEO, very early onset IBD, Crohn's. She'll be 11 this year. I knew about the age 2 that she had something very wrong. Currently, we are on our 4th biologic due to insurance denials.
So the infusion process is daunting, to say the least.
That process is an entire day's worth of sitting in the hospital. Normal childhood activities were being replaced by hospital visits and injections and infusions, and basically her childhood was being taken away.
The way VEO Guardians got started is that many of the medicines we use are in this category called biologics.
And basically a biologic medicine is a specific targeted medicine that targets proteins in our immune system. So we might infuse a whole, a bag, which is basically donated from humans. It's an expensive medicine because it's very intricate and they're very specific to the immune system. So all these medicines are super pricey.
After my son's specialist submitted the request for approval for biologics for my son, we faced delays, denials, and appeals. Every day felt like a year watching my son struggle.
After my daughter's specialist submitted the request for approval for biologics for her, we faced delays, denials, and appeals. I sat in the pharmacy drive-thru and was told her biologics were denied by our insurance company, but that I could pay for them out of pocket. I was told they were $7,299 for 2. She needed 4 for 1 month.
So many families have to wait, sometimes months and months, 6 months before that child is able to get a medicine.
We really do need to be able to provide timely care because that impacts their long-term outcome.
So the fact that VEO Guardians is going to be able to provide the upfront cost for that medicine, it's life-altering. It's going to be life-altering for these families. I can't say enough about it.
I would trade places with her if I could. If I could take it away and let it be me, I would.
It would change the world for him.
Knowing that my son could get the medications he needs when the specialist say he needs them, that would change everything.
Lights will guide